welcome back to our practice. You are probably here because you need a dental health check. So I am just going to explain a couple of things before we start. Firstly, I hope you and your loved ones have been well over this period of uncertainty. We had been closed for about 3 months and then opened in June. And because of that, we've had a little bit of a backlog in patients who need to be seen for dental health checkups. So Agnes Deans, our dentist, who most of you have probably already met, she's been with our practice for about 3.5 years. She's going to be seeing you today, and we do try very hard to do exactly the same things, but as you know, we're all human and we all do things slightly differently. So we thought the best way to deal with that is that I give you a little recap of what I spoke to you about last time I saw you. So once Agnes has done her dental health check, if you need any further appointments for any restorations or for a general prevention or scale and polish, you will be referred to the reception, where Vic will schedule an appointment with myself or with Jane, our hygienist. Now, a couple of small things. Firstly, we have started sending out a newsletter to all our patients. The newsletter includes a lot of the infection control measures that we've put in, anything that you need to know which is important in this COVID-19 situation. But also there's a lot of nice stuff from patients, things about our practice, new equipment that we're using, and just general information such as, for example, how you can do your own oral mouth cancer screening at home, and little tips on how we can help you maintain a solid, healthy mouth. So if you haven't received that newsletter, can you please let reception know? Vic will help you out. He'll check if we've got your correct email address, and also that we've got consent to send you the newsletter. Please also just make sure that you've also checked your spam, because sometimes it does go into your spam box. Okay, so when it comes to safety measures, of course, dentistry's always been very, very high on infection control. We've always had lots of different viruses and bacteria that are already in our everyday life, such as tuberculosis, such as hepatitis, HIV. So the dental setting is already a very, very safe environment. But of course, with this COVID-19, we've put in extra measures. We've used the Public Health England guidelines, but we've also used Australian guidelines and also New Zealand guidelines, the best guidelines that are to be found in the world. One of the things that is very important right now is to have very good air circulation in the surgeries. So as you probably know, we've already installed 2 very, very high suction volume air exchangers, where we are meant to actually only exchange 6 air exchanges per hour. Ours is doing 22 air exchanges per hour, and that is to provide you with a very safe air to breathe in, but also for our staff members as well. So we feel very good, we feel very safe in providing you the service that we do. Now, the first thing, as you know, I always go through your medical history with you. Agnes will do the same. The medical history is something that is extremely important in dentistry. Any changes in your medicines or any conditions that you may have developed. So why is it important that we know about these changes in your medication? It's because we are actually putting a lot in your mouth that can interact with the medication that you're on. We use a lot of chemicals in your mouth, so if you're allergic to something, that can be quite dangerous. Also, a lot of your medicines have side effects such as bleeding gums, swollen gums. You can interact with local anesthetic. It will give you heart palpitations with the adrenaline that we use. Dry mouth, ulcers, fungal infections. There are so many things that can happen because of the medicines that you're on. And if we know the true picture, then it's easier for us to actually provide you with a safe treatment and an appropriate treatment. So I will see you very soon on your next dental health check or for your restoration if needed. Please do not hesitate to let us know if you have any suggestions on what we can improve on. We've got a little suggestion box where you can pop in a little message anonymously, or just let Vic know at reception. Alternatively, just give me a call and I'll be happy to have a little chat with you. See you soon.